Fetal alcohol syndrome is a lifelong developmental disorder with differing mental and physical problems that may occur in a baby or young child when a mother drinks alcohol during pregnancy. Using or abusing alcohol during pregnancy can cause the same risks as using alcohol in general. However, it poses extra risks to the unborn baby. When a pregnant woman drinks alcohol, it passes from the placenta to the fetus. Because of this, drinking alcohol can harm the baby's developing brain. A pregnant woman who drinks any amount of alcohol is at risk for having a child affected by the alcohol. No safe level of alcohol consumption during pregnancy has been established. Larger amounts of alcohol appear to increase the child's difficulties and the likelihood of a fetal alcohol syndrome diagnosis. Alcohol use appears to be the most harming during the first 3 months of pregnancy. However, drinking alcohol any time during pregnancy can be harmful. A baby with fetal alcohol syndrome may have the following symptoms: poor growth while the baby is in the womb and after birth, decreased muscle tone and poor coordination, delayed development and problems in 3 or more major areas, including thinking, speech, movement, or social skills, heart defects such as ventricular septal defect or VSD, or atrial septal defect or ASD. Problems with the face, including narrow, small eyes with large epicanthal folds, small head, small upper jaw, smooth groove in upper lip, smooth and thin upper lip. If you have concerns that your child's birth mother consumed alcoholic beverages during pregnancy, your pediatrician can watch for signs and symptoms of this syndrome in your child. To make a diagnosis, doctors will assess growth, facial features, heart health, hearing, vision, cognitive ability, language development, motor skills, and behavior. Fetal alcohol spectrum disorders, or FASD, is an umbrella term used to describe a variety of the effects or disorders caused by prenatal alcohol exposure. Different children have different effects of FASD, such as cognitive impairment, growth delay, distinct facial features, and behavioral problems. Each child with FASD is unique and will have differing strengths and challenges. Doctors may refer a child with possible fetal alcohol syndrome to a medical genetics specialist to rule out other disorders with similar signs and symptoms. If one child in your family is diagnosed with fetal alcohol spectrum disorder, it's important to evaluate his or her siblings to determine whether they also have been exposed to alcohol prenatally. Since every child develops differently, sometimes it's very difficult to tease out the difference between individual variation and the sometimes subtle effects of prenatal alcohol exposure. There's no cure or specific treatment for fetal alcohol syndrome. The physical defects and mental deficiencies typically persist for a lifetime, and treatment may include surgery and counseling. Learning problems are best addressed by special educational services in school. Parents often benefit from counseling to help the family with a child's behavioral problems. Infants and children with fetal alcohol syndrome may have different problems, which can be difficult to manage. Children do best if they are diagnosed early and referred to a team of healthcare providers who can work on educational and behavioral strategies that fit the child's needs. The psychological and emotional problems associated with fetal alcohol syndrome can be challenging. Families and children with fetal alcohol syndrome may benefit greatly from the support of professionals and other families who have experience with fetal alcohol syndrome. Ask your doctor or public health nurse for local sources of support for families and children with fetal alcohol syndrome. As a parent of a child with fetal alcohol syndrome, you may find the following suggestions helpful in dealing with behavioral problems associated with the syndrome. Implement daily routines to which your child can become accustomed. Create and enforce simple rules and limits. Point out and use rewards to reinforce acceptable behavior. Guard against their being taken advantage of by others. Teach your child skills for daily living. Carefully choose whom you ask to care for your child when you can't be there. because some behaviors may be difficult to manage. A stable, nurturing home is the single most important factor in protecting children with FAS from some of the problems they're at risk for, including drug abuse, dropping out of school, and encounters with the juvenile justice system. Children with FAS may face challenges in school such as a short attention span, memory deficits, poor motor skills, hyperactivity, behavioral challenges, and difficulty interacting with peers. Schools can help support children through special education classes that focus on repetitive and hands-on material. Schools can also help mitigate behavioral and peer interaction problems by having sufficient positive supervision of students through teaching aids or by placing students in supportive, small class environments. If your child cannot sleep at night, shorten naps or cut them out completely. Some children benefit from a formal sleep evaluation or sleep aids. Pair your child with another who is 1 or 2 years younger. Create a stable, structured home with clear routines and plenty of repetition. Medication may be helpful. Keep the child's environment as simple as possible and structure time with brief activities. Remove your child from a frustrating situation and use calming techniques such as sitting in a rocker, giving a warm bath, or playing quiet music. Young children need their development monitored constantly and may need additional support when their learning trajectory plateaus. Repetition, consistency, and clear consequences for behavior are important. Some young children require special education assessments from their state's early intervention or local school system. Monitor any ongoing developmental or behavioral issues. Medication and therapeutic counseling may be helpful for anxiety or depression. Encourage your child to participate in sports, clubs, or other structured activities. Monitor the activities of your child and discuss dealing with strangers. Family counseling is helpful to address lying, stealing, and antisocial behavior, as well as setting simple and consistent rules with immediate consequences. Effects of FAS are lifelong. Challenges may include poor social skills, difficulty with impulse control, challenges with boundaries, and poor short-term memory. As a result, adults affected by FAS may have difficulty maintaining employment, experience substance abuse issues, or need assistance managing money and other daily living tasks. Adults with FAS may benefit greatly from supportive living and social services or homemates to help address these issues. Because FAS is on a spectrum, strengths and challenges will vary for each individual. The Adoption Center partners with families to provide compassionate, state-of-the-art care to children with issues related to FAS. Our services provide the necessary developmental and behavioral supports to address a family's concerns about fetal alcohol exposure. Our team can assist with both pre-adoption and post-adoption evaluations, and even provide in-country consultation when necessary. Comer Children's Hospital at the University of Chicago gives patients access to the highest quality pediatric infectious disease subspecialty care. Our care allows families access to the most current national guidelines and research involving the care of children and adolescents with issues related to FAS. Our 5-visit post-adoption evaluation helps families welcome a new child into their home while synthesizing disease-specific information and integrating the care of this child into normal family life. The post-adoption evaluation includes both medical and developmental and behavioral care. UCAC is part of University of Chicago Medicine Comer Children's Hospital, with access to the highest quality pediatric infectious disease subspecialty care. After UCAC's 5 adoption visits, your family may choose to continue on with us or transition to a local community provider. Families who choose a local community provider will receive a transitioning packet for the pediatrician, giving a background to your family's story. If needed, our team is able to provide longer care relationships, especially for children with FAS or other significant special needs for chronic health concerns. In addition to serving as liaison to referring specialists at Comer Children's Hospital at the University of Chicago, our team also provides checkups to monitor your child's progress if needed. Whichever path your family takes, know that you can always come home to Comer.